Good morning. I'm Janie Parrish with the Wadsworth Area Chamber of Commerce, and you are zooming into business to the north end of Medina County, but also everywhere in Medina County. So today I'm with Krista Wasowski, who is our wonderful Medina County Health Commissioner. So good morning, Krista.
Good morning, Janie.
It's been a rough couple years for the health department. And the reason that we wanted to talk to Krista today is that they are putting the health levy back on the ballot in May. And we wanted to find out a little bit more about it from Krista, right? From what, because she knows everything that's going on in that health department. But the thing of it is, before we start, I want you to note that when the health levy came out, I sent that to our board of directors and they resoundingly said, yes, please, let's endorse this health levy. So Krista, tell us about the health levy and what you do, and don't go into details about that COVID, because I don't think you can talk about it without your eyes crossing or your shoulders twitching. Yeah.
Well, Janie, and you know probably more than a lot of other folks, we do so much more than that, but that has certainly brought a spotlight onto the work that we do every day for the public. But you know, we've been your health department and serving the entire county for over 100 years. And back then it was more about controlling smallpox and scarlet fever and diphtheria, you know, but in modern times it's more about promoting health and preventing disease. And most people know us as the Medina County Health Department, but actually our legal name is the Medina County Combined General Health District. That's a mouthful.
You know what, that's kind of like a royal name. They have a lot of names. So this is kind of royalty.
So that's how we'll appear on the May 3rd ballot, because that's our legal name. It was the 3 cities and all of the townships joining together back in the late 50s and early 60s so that we had one health department. It's very efficient. Unlike a lot of other health departments in Northeast Ohio, there are several counties where they have 2, 3, 4 health departments. And residents have to figure out, who do I call for my birth certificate, or which has which service? And we don't have to do that in Medina County. Everybody, whether you live in Wadsworth or a township or another city, you can just call us because we're your place. And we really pride ourselves on being efficient. A lot of the things that we have done in the most recent past has been to really embrace technology for those citizens who want to connect with us in that way. And we know that not everybody does. So you can still call and get a live person when you call us, but you can also submit requests to us online, plumbing permits, things that you used to have to send multiple copies and wait days and days to have work done. Now it can come to us electronically. Our staff can mark it up and send it back, and people can get moving along the way of things that they want to do, particularly with businesses, because we've embraced technology. But by doing that, we've also increased our costs because of technology. So now, you know, the firewalls and the antivirus and all the secure servers and everything we have to do that type of work for you, but in a safe way and in a way that is, you know, protected. We have to have all those other structures in place, which is something that we didn't have to do 30 years ago when this levy was last replaced. So the levy that's on the books is a 10-year renewal, but it's been on the books. Really, this one has been on the books since the 1950s, but the last time it was replaced was 30 years ago. But we're not asking for replacement. We're asking for it to be renewed with a very small increase attached to it. So what is the increase for? It's for technology and our cost for technology, but it's also because the state changed several years ago how we draw in grants. So it used to be that we would receive 3/4 of a grant, and then in the 4th quarter, we'd even up. Either they'd pay us that last quarter payment or we'd send them money back. The state no longer does it that way, Janie. Now we have to front 100% of the money for all of the grants that we do. So people might be surprised to know that we have over $1 million tied up every year in money that we've put out that we're waiting to get back again from the state. And so we have 18 grants right now just from the state health department, but we have to do that with every grant from Department of Public Safety, Agriculture, EPA, and everything from health. So that's a big change for us. That's something that we didn't anticipate 10 years ago, the last time that we renewed. So we need to ask for that small increase along with the renewal. And the Board of Health, when they considered how they were going to do this, a replacement would bring in far more money than we would need. We don't want to bring in more money than we need. This, with levies are about a third of our budget. And a third of our budget are fees and contracts. And then a third are all the grants that we bring in. So for us, it made more sense to ask for the renewal of the 0.7 mil, and then ask with that a very small increase of 0.15. So the increase amount, the 0.15, that costs $5.20. And the total amount is $14.70. Actually, I think the increase might be $5.24. I missed the 4 cents, Janie.
Okay.
So, so for us, the renewal, and for everybody who's really savvy about levies, that the renewal, because that levy's been on so long, the state kicks in 12.5 cents for every dollar that's assessed. So that's really protective of our property owners and our businesses. By doing it that way, by doing the renewal and the small increase. So that's what we're asking for this year. I know there's been a lot of confusion about whether we're having an election or we're not. We are. It's May 3rd, but early voting is open now. You can still request an absentee ballot. You can walk in over at Stonegate, over behind Hobby Lobby in Medina, and you can vote in person. I know next week they're going to have evening hours until like 7. And then next Saturday and Sunday, you can even come on in on the weekends. You can grab a little bite. You have a little bite to eat in Wadsworth. You could drive up to Medina for a little afternoon. But it's so important for us truly to get everybody out to vote and to vote yes for our levy and support us. It's core funding for what we do as a health department and what we do for residents every day.
Now, my very first job after I graduated from college, I might have been a little bit older than your traditional student, but was at the Medina County Health Department. And I am still amazed all these years later, the amount of services that you provide. So tell us about your divisions within the health department.
Sure. So we have our environmental health division. That's our division that does a lot of the mandated work that we have from the state. The state, under Ohio law, we're required to do a lot of work on their behalf, but they don't fund us as an agency. We're not a county agency. We're not an agency of the state. We have to support ourselves. So environmental health does a lot of the regulatory work we do, but we do have programs that are 100% funded by levy, things like tick identification. People can bring a tick in if they have had it on themselves, and we have an entomologist that can look at that from the state. We have an electronic connection with them, and they can tell you what type of tick it is and what disease it might have been carrying. We do our rabies program. If people have had a bat in their home, they can bring it in and we'll send it down for free rabies testing. We wouldn't want people to have to get a bunch of those shots if they don't need it. So
Sure.
we do that service. Our mosquito program is something else that we do out of there. We go along and put long release tablets into ditches and places that hold water to kind of keep down that mosquito population in the summers for folks. But that's what environmental health does. And then community health is actually a lot of our health promotion. They're the folks that have been doing all of our most recent COVID response, but every day they monitor hundreds of communicable diseases and follow up on those with individuals. We also have our WIC program, Women, Infants, and Children, our nutrition program. That's a huge grant program, and all of the coupons that come in from that program get spent back into our businesses here in the county. And it's good support for young families that need a little extra nutrition help. And then we also have the other programs, newborn home visits. We're still a health department that goes out if a parent has a new baby, and we offer to send out a nurse who's a lactation consultant, who's a car seat installer tech, who can weigh and measure and help reassure individuals. You know, families don't always live close anymore. And so that's a service that we do. That's 100% levy funded. We have the Bureau for Children with Medical Handicaps back there. Kiddos, if they're not exactly sure what's happening and they need some diagnostic help, we can help fund that through a state program. And you have to come to your local health department to have that happen. But the state pays us the same rate to do that as we have for the last 25 years. But we still do that program, and it's important for families that we do it to help get them connected with what they need. Then we have our health center, which is a large section of our agency. We have an office down in Wadsworth now, so we're doing primary medical care down there. Everything is sliding fee scale. Everything that we do, it's based on income, and people can attest to what their income is with us. We want people to be healthy. We want businesses to have employees that are healthy and able to come to work, and they're not worried about their family's health. So they can come to us and we can connect them in if they need something more than that. We have agreements with other specialists as well. And then we have up here at our Ledgewood address, of course, we have our dental clinic, and that's something that is also sliding fee scale. We do things from cleanings to dentures at our health center up here for dental. And again, something really important to overall health that we've been doing for, gosh, it's been like 16, 17 years now, Janie, that we've had the dental clinic. It's been a good long time. Yeah. And then of course, administration, that's the backbone of a lot of things. And that's the division where we have vital statistics. So if you have a new driver or you need to prove your age of your child for soccer enrollment or softball or baseball or something, we're your place to come to get a birth certificate. And of course, we do death certificates and paternity things and some other things like that out of vital statistics. But there's so much more behind all of that, Jeannie. There are just hundreds of programs that we do here. And so much of it is, people don't know necessarily that we do it until they need us. And they're always really glad that we're here to help them. And we're so glad to be here. We want to be here for many years to come, to be your local health department, a local place that you can come in and do that.
And I just wanted to throw out a couple things too, Krista, things that I have just always been impressed with is your food service program. So when you go into a restaurant in Medina County, you know that there's food safety going on, that they've been prepared, they've been educated. It's wonderful. So when they say that the health department touches everything, it does touch absolutely everything. They do pool inspections, septic inspections, pond inspections, and I was thinking
campgrounds and public pools at hotels. Yeah.
And not to mention this incredible COVID, everything that went with that. And I was telling my husband about, it was amazing to have you send us a weekly report to give out to our community so that they knew exactly what was going on. The transparency was absolutely amazing. But I was thinking when you said about how you've came so far in technology, you know, to help businesses. My dad was an excavator, and I can remember, of course, he retired in 1976, so we've came leaps and bounds since then. But I can remember him waiting at home to use the phone to call the health department for inspection, and until you opened at 8 o'clock, because there were no cell phones, there were no computers, you know, at that time, and how much that would have been made his life a whole lot easier. So we just came leaps and bounds, and I'm so thankful that the health department has hopped on to that too. And I did want, look, whose interview is this anyways? I'd like to know, but I just keep,
I love it. I
just keep happy.
Totally. Yeah.
So on April 29th, the health department will be at the Wadsworth Public Library from 2 to 5 for your booster shots for your COVID vaccine. And so there's no age requirements, right? Now, what about children?
Well, so children, yeah, we can do older children. We do everyone, when we come out to our clinics, absolutely. Anyone who's eligible, we will do. We bring out all the vaccines. Now, younger children can only get Pfizer, but we'll have both Pfizer and Moderna with us. And so adults for booster, we'll do primary doses, we'll do boosters, we'll do second boosters for people who are ready and age appropriate for a second booster. We'll have all of those there.
So between your first and second booster shot, what is the time frame for that?
4 months.
4
so
months.
It has to be 5 months from your initial 2-dose series. It has to be 5 months. And then for your second booster, it has to be at least 4 months since that first booster that you got. And that could be Pfizer or Moderna. That's up to you.
Okay. I really appreciate the fact that you're doing this in Wadsworth. That is just awesome. And especially it's such a great public place at the library, because everybody knows right where it's at. It's easy to get to, good parking.
We've been at plenty. So this is our 71st week, I think, straight of doing vaccine and taking it on the road. And you know what, Jeannie, that has been important. That has been important for people to have something that's convenient for them. Right. And we've been at several different locations down in Wadsworth. Certainly we were over at your senior center location initially, and we've been out at SUMA, but really being at the library, that's been, like you said, it's a place that's easy. It's easy for parents and adults, and everybody knows where it is. Right.
And also at the your health center here in Wadsworth, which is hooked on to the SUMA Health Center. Now, what can you go there for?
We can do anything primary care there. So you can go there for a women's health visit. You can go there for a well child check. You can go there for a physical, your own update. You can go, we'll do a lot of different screenings and things. We can order tests and things for people. We can do consultations. We are in the process. We had a social worker. We're in the process of hiring a new social worker, but we also can help people see if they're eligible for Medicaid. We can help them get on the exchange if they need insurance. We can help them with that process, and we can connect them with other services in the community. So really kind of a one-stop place. If somebody isn't sure where they need to go or what they need, they just know they need some help, or they know that they need to do something about their health, and they are unable to get into maybe a doctor that they saw years ago, or they've had a change and they want to try something different. We're happy to be there. And really our focus is on making sure that people can be healthy and have what they need to lead a really good life.
Oh, for all these years since I've worked at the health department, I've been a huge fan of the health department because I just know how much you do. And I think that it is a gem in Medina County, and the health department has such an amazing reputation for the stellar work that they do. So if you could extend the thanks to all of your team members, that would be terrific. Yeah,
I certainly will, Janie. We just received our recertification. We're nationally accredited. We were one of the first 100 in the nation to become accredited. And I really, and that's truly because of the work of all of the individuals here and how much they truly care about the community that they live in.
Boy, and that's the truth. So on May 2nd, you've got my support, and you have our board of directors support as well. So thank you, Krista, for all you do.
Thank you, Janie. Thank you so much to you in the chamber.
Absolutely. Yep. Have a good day.
Thanks, you too.